What good is the implementation of access if we aren't thinking about all of those who need it? That's a question Dr. Nicole Riddle is actively asking us at the American Medical Association and at other establishments where disabled physicians are often forgotten. As a disabled person since childhood, Dr. Riddle has been forced to navigate the world without her in mind. She has been left without ways into buildings, told costs are more important than giving her a way in. Well, Dr. Riddle says enough is enough, and we agree. Let's hear from her. This is Dr. Riddle.
If we want to train good physicians that think of all of their patients, putting them in that shoe or on those wheels for a day or two would really be eye-opening. My name is Nicole Riddle. I am a practicing pathologist at Ruffalo Hooper and Associates at Tampa General Hospital and also an associate professor for the University of South Florida Health Morsani College of Medicine. I am a wife, I am a mother, I am a doctor, and I try to be a good and kind person. I was born with a bone disease and spent a lot of time in hospitals. I may or may not, when I was 8, told my surgeon, who was chief of staff at the hospital at the time, that I was going to take over for him when he retired. When I got into multiple medical schools, knowing I wanted to do orthopedics at the time, I was like, okay, which one would I go to? And I ended up choosing University of Florida. As a pathologist, I certainly run into most people that don't know what pathology is. Pathologists do everything from running the blood bank to organ donation. When the surgeon or any other doctor takes a biopsy, it comes to the lab, it comes to me, and we make a slide. And so microscopically, I can look at it and make a diagnosis. All caps indeterminate. Talking to medical school classes or even colleagues, and we'll talk about how it's ridiculous that I can't get to the front of the lecture hall because of stairs, or it's ridiculous that there's this massive door right in the front of the hospital that they just renovated that they then have to keep closed and didn't put an accessible button on, that every patient who comes in has to go through. It amazes me how much administration, who even though as humans they might feel for you, will not necessarily put the money behind it to fix it. So there's just really needs to be more education and awareness, and the fact that a lot of these things can be done cheaply and easily if you just keep them in mind from the beginning. If I take the opportunity when it presents itself to educate people and let people know. I am well aware that this is my path and this is my story, but I also know that there are other people that have other paths and other stories, and I try my best to always listen to those because they all matter. Like that myth that only the wealthy can go to medical school. I feel like it's a shame that we're not telling all kids that if you do well in school, there is a place for you in medicine. Those opportunities are available for you. When it comes to making the difference and being the change you want in the world nowadays, you just have to keep trying. You just need to keep speaking up. But I have a diffuse.
Now we show.
It's amazing to me because so many of my friends, until they hung out with me, and sometimes, I have to use a wheelchair. I can't do a curb. They say now when they're going around, they'll be like, how would Nicole get in here? What would Nicole do? I try whenever anybody doesn't know how the AMA works or says that they might not be the biggest fan of something the AMA did, I remind them, I'm like, let's a vote. So I always tell people, get involved, become one of the people, lend your voice to be heard.